Because that was similar to what Trump took, but a different company, right?
Yeah, same principle.
Okay, we are live. Welcome, everybody. As usual, you got Matt Butterworth
Howdy.
and Fabio Magrini.
Hi there.
For those of you who don't know, Matt Butterworth is a software engineer and an analyst of sorts.
Of sorts.
Fabio Magrini is an MD, does clinical research for pharmaceutical companies primarily, or
Yeah.
basically analyzes whether drugs work or they don't.
Right.
And he also had COVID early in the year, back in March, and had a a significant case. He survived, but it was not an easy blow by blow. So he knows this thing personally, and at an analytical data level.
Right. I'm one of the 10% of long haulers. So yeah, very privileged to be part of that elite.
The elite who didn't just bounce back.
Right. Yeah.
No long-lasting effects.
Yes.
So let's start. Let's let Matt start here with what he's looking at data-wise. We're seeing a rise in cases. We're seeing a rise in hospitalizations. We're anticipating seeing a significant rise in death rates, and we're beginning to already, right?
Mm-hmm.
Or not, just to say deaths. So Matt, why don't you get us kicked off here? What are you seeing?
Well, yeah, I think, we have the most, cases per day, the most hospitalizations currently. But I think what's important to state is where it's happening, right? Because when you look at the data and the maps, in LA and in New York and even, Florida, these are not true statements, right? There's some uptick, but the Midwest is really seeing some highly virulent activity. And I'll let Fabio kind of describe if maybe it was rallies in states, was it the in-person voting, is it the cold weather? Are all of these things kind of colliding to create this, going from 50,000 cases a day to 150,000 cases a day, right? Because that and within about a month's period of time, right? That's a pretty extreme increase, right? And then we're also seeing the spring spike, which is primarily the tri-state area, some Michigan, some Louisiana. You had about 60,000 hospitalizations at the peak there. Summer peak, which was California, Arizona, Texas, Florida, got about to 60,000 hospitalizations at the peak there, and now we're at 70,000 hospitalizations on this kind of the fall peak, if you will, which is seems to be really affecting areas in the Midwest. As I said, the Dakotas, they're kind of interesting because they're new to this virus, but they're getting close to having a 10% quote unquote known infection rate, as well as their hospitalizations, per capita are above any other state outside of New York in the spring. So we're seeing, and we're seeing in places like Texas, overall, they're not hitting that, but El Paso, Texas, 40% of their hospitalizations are COVID patients. I've never seen that 40% of hospital beds being used in a region so far. Like, that's actually one of the more alarming things, is seeing, because normally like Texas got up to 20% of hospital beds being used in like the Houston and Dallas area, but El Paso is 40%. That seems That seems like a massive increase from what we've seen, and it has to be putting a load on the medical system there, because you have your normal medical needs that these hospitals have to tend to. So if COVID's taking up 40% of that capacity, that seems like it's problematic.
Yes, but that was always the case, right? It was always the issue that was raised at the very beginning of the pandemic, which was, yes, there's going to be more hospitalizations, but what comes from the hospitalizations is going to create a disruption on the health services, right? So when you have 40-50% spike in hospitalizations due to a single cause for patients that need to be isolated and quarantined, then you create a big problem for that health service structure as a whole. And what happens is that on the back end of that, you need to start postponing routine surgeries, emergencies, people with heart attacks, people with acute problems might not be treatable because they can't get access to health service. The same is not, this is not just the US. I was just talking to my mother again this morning, and in Italy, despite of the new shutdown, they are running out of spaces in hospitals, especially in places that were not that affected during the previous spike. So before, it was mostly in the north.
Yeah, the Lombardy region was like
Right.
their epicenter early on. Yeah.
Right now is more in the south and in the center. There's big kind of clusters in regions that weren't that heavily affected before, because they, people have been going around. They've been traveling a lot, right, between different parts of Italy, and therefore the virus has been spreading. Personally, I look at hospitalizations and deaths as the number to guide what's happening, because the number of cases, it's really weird. I still can't understand whether we are talking about positive testing, which is a different issue altogether, or confirmed cases. It seems to me that 140,000, 150,000, 200,000 that we're hitting are the number of positive tests. And that's why the hospitalizations are kind of trending behind. But I was just looking at the figures on NPR on the COVID tracking project as of November 13. And in terms of hospitalizations over the last 2 weeks, overall, we had about 21.8% increase. And when we look at deaths, we actually seen, so when we look at cases, we see a 70% increase. And when we look at deaths, we see a 22.5% increase over the last 2 weeks. The issue, Matt and Andrew, is that this is not the peak of the wave. We are not even close to the peak, because the peak is expected to, we are expected to reach the peak sometimes between December and February.
And what influences that projection as far as is it just the population that can still be exposed to it? Is it the regionally, if people are taking precautions? Because I know like North Dakota is going down a totally different road than South Dakota, and
Right.
will that change their trajectory?
Well, we know that social isolation, social distancing, wearing masks, and shutting down non-essential businesses slows down the spread of the virus. We've seen it very well in Italy. We've seen it in China before. We've seen it in the UK, we've seen it in Germany, we've seen it in New Zealand and in Australia, right? So those countries that actually have, implemented very quick measures to stop the virus spread in the community, they have successfully slowed down that virus. The problem is that immediately after, in all of those places, those measures were relaxed, businesses opened again, and people stopped wearing masks and social
The
distancing.
question is this what's happening here right now? Is the real cause of the jump in numbers? Is it really about this relaxing that we're doing, or is it rather related?
To me, it's twofold: is the relaxing in itself, and the fact that we are hitting the cooler season. So viruses, and specifically this kind of virus, spreads better in a humid, cool air. People don't tend to congregate outside as much, but tend to cluster indoors more. Instead of walking to places, people are taking public transport, for instance, so on and so forth. Right. Then you have another component, which is, again, similar to what's happening in Italy. There's a regional spread, right, which is very similar also to the Spanish flu. So the Spanish flu started on the coast, right, and then in the second wave, it started spreading into the Midwest and to the rural communities.
So right now in the United States, we already have it now. There are little clusters all over the country now. It's not just on the coast, it's everywhere.
Right. And that is made worse because if you think about it, between the beginning of the 20th century till now, mobility has increased exponentially. People travel a lot more. They go from one place to the next. It's not unusual. 100 years ago, it was very unusual to go 100 miles away, right, from where you were. Now, traveling 100 miles is a question of a couple of hours or even less. So the spread in terms of community spread is much faster and much more granular than it was back at the beginning of the 20th century. So I think we've seen a combination of many different factors. And also, we still had this problem with these tests, that are not reliable. I was reading about Elon Musk. I mean, it's not.
That was on my list of questions for you. Is Elon Musk too positive, too negative? He sent one to the lab, and we don't know the results of the lab, which I think would be important to know so that we could see, did he just have not enough of the viral load where it made the test go both ways, and the lab would be the more definitive test?
Yeah. So we spoke about this with Andrew a while ago, but just to cut a long story short, the problem with testing is that what is normal, what is positive, what is negative, it's a median, right? It's a mean value that is found by calculating all of the average values collected by the test across people. So when you come to borderline, especially if somebody is very positive or very negative, then I think you have more accuracy. But when you start going into that gray zone of weekly positive and weekly negative, that can happen. For instance, if you have symptoms for a couple of weeks or you had infection, the infection happened a couple of weeks ago, right? And then you go for a viral test, and that viral test might not capture, the full amount of virus, or the procedure is not conducted correctly, or the sample is not stored correctly. So you might lose, concentrations of the virus. And when you run a test, you end up in that gray zone of weekly positive or weekly negative. But then it's a toss of a coin. Could be positive or could be negative. It's all about the sensitivity and specificity of the test. And when we speak with Andrew, we talked about the fact that when it comes to specificity and sensitivity, those are also a function of how strongly the test is, the disease is represented in the community. So the rarer the disease, the less frequent the disease, the more you're going to get false positives and false negatives. And the value of spread that makes sense is around 20%. So any kind of level of spread which is less than 20% of the overall population, you would have a lot of false positives and false negatives, especially in those, borderline range.
And this is primarily because when they do the viral test, they have to put it in a replication process, and it goes through a set number of cycles.
Yeah.
And that produces a certain amount of virus. It's then visible under an electron microscope, right?
Well, no, yeah, I mean, it's not quite so. It's almost independent from the methodology. So you have RNA tests, you have cell-based tests, you have immunofluorescence tests, you have a number of different tests that we use normally in clinical practice to look for autoantibodies, to look at, bacteria, viruses, a whole host. Almost every test that we run when you have a blood test is based on a methodology, right? Some of those methodologies, for instance, when you do a full blood count, that's very kind of narrowed down because everybody's got blood, has red blood cells. Those tests have been kind of executed for, 50, 70 years. So we have a very good idea. And yet, even for those tests, we have seasonal and periodical adjustments to the level of positive and negative. Imagine the BMI, right? BMI was 24, 25, normal was 24, 25, 30 years ago, now it's 27, 28. So, people change, we're talking about biological systems, and therefore those tests also need to be adjusted. But it is very much independent from the test. So the criticism that the test doesn't test the virus is a little bit bogus because no test for anything almost tests what we are actually looking at. When you test for blood cells, you're actually not counting 2 million or 3 million or 5 million blood cells on a microscope and kind of point them out and count 1, 2, 3, and then 5 days later 5 million, right?
Yeah.
You have a sorter that kind of extrapolates the number according to an algorithm. So that's true for every single test. Vitamin D levels, even those tests, they are so much loved by our friends naturopaths, and they rely so much on those. They also based on the same principle, which is mostly a statistical, assessment of an analysis.
So back to Elon Musk.
Right. So Elon Musk, tested positive twice and then tested negative twice, and he said, "What the hell? What do I believe?" And this is not just the first time that happens, right? We heard before people testing positive, then negative. This idea that some people, for instance, get reinfected, but do they get really reinfected, or they had the infection and the test failed, right? It adds to the confusion because we know that the viral test has a large, 30, 40% false negative rate. We know that the antibody tests, as we discussed last time together, can have up to 80% false positive rates. So it's very difficult to rely on the test in isolation in the absence of symptoms. And even in the presence of symptoms, you can't really say that somebody doesn't have coronavirus, COVID-19, because the test came out negative. Again, that is my personal experience. I never tested positive throughout the last 9 months. and yet I had all of the symptoms. I had I started being sick at the same time as my friend, and we both have been in touch with somebody that tested positive and was sick. So, all of the evidence was there, all the symptoms were there. The test happened to be negative. So what do? Do you believe the test, or do you believe clinical practice? And that is why I look at hospitalizations and deaths rather than looking at the number of positive tests.
That's the same thing I do. Is like, let's stop talking about tests. Let's
Right.
talk about hospitalizations, because there is a correlation, right? When the
Right.
positive tests go up, the hospitalizations go up.
Right.
So even if there are the false positive and questions on the test,
Mhm.
there's been 100% correlation on the increase in positivity and the increase in hospitalizations.
Right.
So observationally, you know that the virus is spreading, even though, like Elon Musk, even he's clearly busy with a rocket launch that happened today, which is pretty amazing. But interspersed with all that, he mentioned that he spoke to a lab, and that the PCR detection, below 30 cycles is reliable and above 40 cycles is not. And I've heard the cycles thing on, if you run the test enough times, it'll end up being positive or something like that.
Well, yeah, so this is like a PCR test, right? So PCR is a polymerase chain reaction. So you take a nucleic acid, in this case, the nucleic acid, the genetic material from the virus, and you put it with reagents and you start replicating it, because you can't see it. If you, even if you have enough virus to give you a symptomatic infection, it's not gonna look like the little monster from Alien, right? It's not, it's not that visible. So in order to detect it, you have to multiply it. So that's what we do with PCR, and PCR is a system that relies on this cyclic duplication, multiplication of a nucleic acid through a DNA or RNA DNA polymerases and other reagents and temperature. So what happens is that you start replicating pieces of DNA. When you take a test from somebody's nose, the swab will contain virus mostly, and you will kind of have probes specifically for that piece of genetic material. But you will also have human material. You will have, kind of contaminants. So the more cycles you run, the more the chance of creating background noise. So, and then when you run the test, in my times, you actually used to run PCRs. I remember, I did quite a lot of those in the lab. You just literally with a pipette, you go in each well, and then you pick it out, and then you kind of put it with the reagent, and you run it into a gel, and then you have bands, and you know that what molecular weight you're looking at, or the length of the band that you're looking at, and you base your results on that. When you run too many cycles, and normally anything between, in my experience at least, which is a little bit outdated, anything above 35 cycles, you start kind of picking up quite a lot of background noise.
Noise.
So it doesn't mean that you.
All right. So this is good.
But you can't really say whether that is the true band. Sorry, go.
Yeah.
I think it's good to describe that, because
So let's move on here. Yeah. So what are we looking at then? What are we looking at as far as the next several months? Matt, do you have a graph that you want to show us?
As far as let's just refresh here. What I want to kind of compare, which is interesting. I kind of commented, but then this thing refreshed on me. Was the hospitalizations per million, right? Because when we talk about hospitalizations, it's good to look at, and then from there, understanding the hospital capacity and what what's the relative percentage of people that are hospitalized, because California is going to have more hospitalizations than any other states, even though that their rate could be lower, just because we have 40 million people here.
Right.
And this thing refreshed on me. But one that I think I sent this to you, Andrew. Let me see if I can draw it together again. Where we see like Utah, they had a state of emergency. I think it was last Sunday, right, and started making restrictions. North Dakota did one of the more interesting things is they're running out of nurses, so they're allowing asymptomatic nurses to continue working with COVID because of a lack of people, right? So that was what they did, and then the governor also, 50% restaurants, mandating masks to be worn indoors, in businesses and things like this. So North Dakota has kind of become not as extreme as like a California, but if you go look at the governor's Twitter feed, it much more looks like a Gavin Newsom Twitter feed than a North Dakota Twitter feed. And why the Dakotas are interesting to me is they're so late to the game. So they're getting this while we have abundant testing. So we're actually seeing, a closer approximation of the infection to death rate, and they're running around 1%. When you look at the positive tests to the deaths they've reported so far, they have a lot of people in the hospital. And the Dakotas are so far taking two different paths, right? North Dakota is saying we need to make some changes to how we're managing this. South Dakota is still doing the let it roll. Whether it's herd immunity, whether they don't, whatever the whatever the thoughts are on it, the actions are kind of telling us that they're following a narrative that this isn't that bad, and all these liberals are freaking out about it, and we don't have to do anything. I think at the rates that their stuff is going, that is going to end up being a bit dangerous. Let's pull up North Dakota.
So the White House, doesn't the White House project 450,000 deaths by February? I mean, this is the White House model, which is the model that is actually the more optimistic model, right?
Yeah, and that's, I mean, if we're seeing these, the increases, I mean, and this is where we want to talk about the vaccine is still some time away, but that new therapy, if there's 100,000 doses of it pushed out to all these hospitals, because we have 70,000 people in the hospital, if they all got this dose today, what would that do to the mortality rate of the people that are in the hospital today? Like that's a question I would have, because if it can kind of reduce everything significantly enough, then that would be really interesting.
Right.
So let me pull up right here.
But we do see a reduction already, right? As people have stopped intubating people, patients at the first sign of the respiratory distress. Even with that, we've seen a very sharp decrease in the deaths, hospital deaths.
Yeah, 100%. Do you want me to share? I can share that screen because you can kind of see.
You can even share your screen. I got you. I got you.
Share that. Right. So here is kind of what Fabio was talking about. When we see the tests, right? We see the cases, right? We see our little bumps here. And then the hospitalizations, interestingly enough, you had the same level of hospitalizations with those first positive case bumps because we just really didn't have the testing early on, right? Or only the sick and elderly were being tested at that time. So we can see the new cases kind of keep going up. And then, these hospitalizations, kind of hitting 60, coming back down to about 30, right? And then the summer, similar pattern. But now we're on this fall, which the cases, here the cases are just, going up at a, like we go back, if we go back down to here, we can see this is a month ago, October 3rd. Or a month ago from the election, I should say, October 3rd. And now it's just been, and even before the election, it was starting to increase at an exponential rate. But now we're seeing it at an even higher rate, since then. And we're seeing, these hospitalizations go up. And we go to deaths, we see that the second wave, we didn't get the same level of mortality from that. I think that's what Fabio was kind of describing. At this point, though, it's hard to say this wave. And this is where I was kind of like, is this thing, because of the weather, going to have more of a New York style mortality that we hadn't seen since then?
But remember that it was more or less the media that described what happened in summer as a second wave. But I don't think that anyone with an epidemiology background expected that to be a second wave. There were a lot of warnings from the experts to say, look, this is not a second wave. This is just a reaction to the relaxation too early of the measures that we took during the first wave. So basically, the second wave was really the tail end of the first wave.
It just kind of hit some shallower ground, and the wave got bigger. If you used wave, terminology.
Right. Created a hiccup.
This is the second wave. This is where we actually see a consistent and widespread increase in the number of cases, which corresponds to an increase in number of hospitalizations, which is corresponding to an increased number of deaths. So when you see that relationship, you actually say, okay, this is probably a wave, because we also don't see regional variations. Everybody is heading in the same direction, right? During the summer, you had California going down and Texas going up, and Florida going up, and New York going down. Now everybody's going up.
Yeah. So this is what I kind of want to show. And I have it on this per million, right? And I have a handful of states here. It includes California, Texas, New York, and the Dakotas. And on the left side, we have the cases per million, and we know early on these numbers you got to multiply it by 10. But the hospitalizations are that's a real number, like you said. That's where I always look. So I think it's good to look at what's happening currently, specifically in this North and South Dakota over here, is the hospitalizations per million are getting are the highest of any other state that we've seen outside of New York.
Mm-hmm.
And even though it's only 621 people, it's relative to the population, that is a lot of people.
Right.
But
there's a lot of people for the healthcare system, because they have a small population, and therefore they would only be able to cope with a much lower number of emergency hospitalizations, right?
Yeah, exactly. And then we see this is the one. I don't know if you guys use this guy, but this is what I pull up because it tells me because it gives you the last 14 days. Let's see, right? Of the last 14 days, your cases per 100,000.
Right.
Right. So this is where when we talk about El Paso over here, with 40% of the hospitals being used, and even up here in the Panhandle area of Texas, there's the hospitals are in I think the 30% COVID usage.
It's interesting. I'm going to throw a little bit of politics in there. It's interesting that the COVID fluke is actually now affecting mostly Republican states, right? I mean, in the first wave, it was those deep reds would have been more or less on the coasts, right? Now it's actually concentrating into the Midwest, which is all kind of states that have been, in strong Republican hands.
Yeah, I shared a TikTok video that sort of shows what from March how all the Democratic, if you do it proportion to population, all the Democratic states were up at the top at the beginning, and then by the time we got to summer, they were all way down proportionately to the conservative smaller states.
It would be interesting to superimpose this to the election map and see what it looks like.
Well, the election map, where the rallies were, what percentage of the population voted in person versus mail-in votes, because the whole idea of in-person voting, that's why a lot of Democrats chose to do mail-in, right? Is when you have this virus that can be very dangerous, and pushing this notion of our history, and we go in person on the Tuesday, and this is part of America. The Constitution says none of this. It's just we've decided to show up on one day to make votes.
Yeah.
Whereas to me, one of the the things that we'll have to see how it plays out, but this in-person voting idea was always a terrible idea when you have a virus running around, especially in states that aren't demanding that people wear masks, that you have distancing. Like the CDC gave guidelines for people to be able to vote in person, even if they had COVID themselves.
Right.
But I'm pretty sure this dark red area we have, that wasn't happening. And is this a result of that? Or is it because the weather system also will get cooler in this area, right? If you look at weather maps, it will get cooler because you get the Rockies here, Appalachians here, ocean there.
Then we should see a sharp increase of infections in Canada, just across the border, that we actually don't see.
Right.
No, that is a good, taking the other view, because we know Canada is dealing with all that there, but they're not, they're more being more diligent about this virus than us Americans are, especially in this part of America.
Well, and again, there was, I think there was an article talking about the rallies, Trump's rallies, and approximately there were like thousands of cases documented 2 or 3 weeks after those rallies from people that attended the rallies, or people who had relatives attending those rallies.
Right.
So it's
it's pretty disturbing to think that it was sort of his election strategy to tell his voters, his supporters, to vote in person, knowing full well that would be a greater risk to them, so that he could then call foul afterwards, knowing that Biden's votes are going to be counted later. I mean,
that was always like,
that's speculation a little bit, but it seems pretty clear that's what he was doing.
I think there is a lot wrong about what has been done, but
there is, there's, the notion of people voting without ID or voting by mail has always been objected to by the Republican parties. This is where we get into voter suppression, right? And, it's very deliberately done since Jim Crow. This is how the South was run by Democrats for so long, right? Is you just don't let the other people vote, and you're gonna maintain your control. And it's and Trump isn't he's not smart enough to put all of this together, but since 2016, he said there was fraud because he didn't win the popular vote. He's like, 3 to 5 million illegals voted because Hillary got the popular vote. His ego could not manage that idea.
I mean, that's another conversation altogether.
Are we transcending? What if we use this to transcend into the politics side of this conversation?
Yeah. Well, absolutely. But when I look at this map, what I think is that clearly this is a virus that doesn't really give a crap about ideology, or whether you believe that you're going to get it or not, whether you believe that it exists or not. It's a virus, and viruses do what viruses do. They spread, and the more you let them spread, the more freely they spread.
Yeah.
And there is no amount of therapeutics that can actually make up for a virus spread. That's why when we have flu season, people with the flu are told to stay home, right? Because they don't want them to spread the flu to the workplace or to their community, or to, when people have the flu in a nursing home, they will be isolated.
Right.
So we do these things on a normal. Huh?
We know a flu in a nursing home is deadly, not as deadly as COVID in a nursing home, but it's still pretty deadly.
So we've been doing these things since the Middle Ages, when we started realizing that some diseases were transmitted. We didn't know that there were viruses or bacteria, or whether it was just etheric waves, but we knew that there was something that was passed from one person to the next. And again, in the 17th and 18th century, where people started dying a lot of tuberculosis, they were kept isolated. Most of those people died alone because their families weren't allowed to be with them. And yet we didn't know it was tuberculosis. We didn't know that it was a bacillus. We didn't know how it worked, but we knew that, you see one person and then the next person being sick and then the other person getting sick, right?
It was visibly clear. It wasn't a
wild. It's not a question of belief. That's what I'm trying to say. This is not something that you believe, you choose to believe or not. You just have to open your eyes and look at what's happening. And then if you want to believe, then that's different. But the objectivity is there.
So Matt, do you have more questions?
I think those are the questions on kind of what's happening on the.
What about the vaccine?
So what is 60%? I'll stop sharing my screen. What does 60% effective rate mean? Because to me, that could end up not being great, because there's somewhere around 10% of our population is likely to have like a severe hospitalized, death experience, because we have, a lot of younger, healthy people that, isn't so effective. So the 10%, I'm like, that sounds good, but if this thing is killing 15% of our 65 and older that have pre-existing conditions, like 10%, like it not working 10% of the time could still be problematic.
Yeah. So the short answer is that we actually don't know. We have no idea, because the vaccine is 90%. This specific vaccine is 90% effective in the testing environment, which means
and the effectiveness means they created enough antibodies to be able to fight a virus. Would that be what effectiveness
they also
is?
look the absence of symptoms, I think. So,
Well, if I were to guess, is they're not exposing people to COVID, aren't they just measuring the antibodies that the vaccine generated to determine if that was enough enough antibodies, or the immune system would know how to recognize and fight this off, or am I misunderstanding that?
not quite. So the study had, I'm just reading now, the study had 45,538 participants in 6 countries. And then they were divided in 2 groups. One group received 2 doses of the vaccine candidate. The other group received a placebo, so just salt water.
Yeah.
They looked at the number of cases. So what they see that 94 confirmed cases from the start of the study were reported in the study group. Less than 10% of those cases were from participants who have been given the vaccine, and more than 90% were cases from the placebo group. So the patient from the placebo group, out of 94 cases, had more infections, more symptoms than the ones in the treatment.
Are they exposing them to COVID, or is it just happenstance? Is it the randomness of?
Yeah, that's why you only have, out of nearly 44,000 people, you only had 94 cases.
Wow, that makes me ask even more questions, because you would want to me, you'd want you to be counting antibodies that are developed from the vaccine, or you'd want them to all go and cough on each other with someone with COVID, and, right? Like, there, like that.
you can't really do I mean, that was how they did vaccines and things during the Nazi period, but since the
we don't do that anymore.
We don't do this kind of things anymore.
No, which is good. Like, so that's why I was curious of how they determine it, because there's a little bit of randomness to your placebo and your who got the two injections. Is what were they equally doing certain things, right? Like, like it's you get a lot of random factors that do influence the results of it. Right?
Yeah, the result, the reality is that we don't know, because all we have at the moment is a press release from Pfizer. So
do they do another, like, to me, 45,000 with only half actually getting the vaccination? When you're doing, when you're going to potentially make 100 million doses of something, I thought that the trials would have to go to even a broader audience.
Well,
to be able to qualify. So
this is the issue with this, accelerated development strategy. Normally, you would have, when you do a vaccine, you would look at children, you would look at pregnant women, you would look at people with coexisting conditions, you would look at the elderly. Those were all populations that were excluded from all of those vaccine studies that we have. Nobody looked at severe infections, hospitalizations, and deaths rates, because with those low number of infections, they really wouldn't be able to do it in the time that they're giving themselves. The other important thing to realize is that most people in those vaccine studies develop antibodies. We've seen it from the AstraZeneca study. We've seen it from the number of studies that have been reported in their interim analysis. That doesn't mean that those antibodies are protective, because again, we still don't know how immunity with COVID happens. We don't even know whether it's antibody mediated or T cell mediated, which is again another completely different.
And we've touched on that one, but
right.
But the science is still not settled at this point.
Right. So we are actually, in my opinion, we're going into we're setting our realistic expectations, and that's why most of the pharmaceutical companies are saying we are very excited about this, but hold on a second, this is like not an overall solution, right? So, it's like the antibody treatments, they can help, like Remdesivir can help, like, other medications can help, but they are not a solution that can replace containment measures. Nothing will replace containment measures for another 2 or 3 years, because that's when we are going to start finding out really what this virus is about.
But if we want to be honest about what's happening, is we saw the map, right?
We saw what?
We saw the map.
Yeah.
Right. The containment, right? Yeah, this is what South Korea is doing. This is what Japan's doing. This is what Taiwan's doing. This is what China's doing. This is what Australia's doing. This is what New Zealand's doing. This is what ISIS is doing. We are not doing that, and I don't even think we could put the shit back in the pig to use that phrase, because you want to have isolation, contact tracing. Like there's very much a science to managing a virus. And I think,
we've already screwed the pooch.
Yeah, I think that, at this point, like, could you actually draw it back in enough? Because your numbers have to be small enough where you can do the contact tracing, you can isolate small regions, for that to work. And when you see these, we're basically in the last 7 days we had 1 million new cases. Right, and it's accelerating.
Yeah, so that's a very, in my opinion, that's also a moral question, right? It's like saying, now I can cure 10 or 15% of cancers, and therefore I shouldn't study any more therapy. I shouldn't waste any more money trying to find therapies for cancer, right? So what is the acceptable collateral damage from something like this? And where do we stop making an effort to contain it? Because the effort is only going to give us an improvement of 10 or 15 or 20%, right? So if we did what Taiwan did, we would be, cool right now.
We wouldn't be having this conversation. It would be only politics.
Conversation, right? It would be a completely different situation. But we are not. And, and mostly Europe is not. The Western civilization has not been controlling this virus very well.
Europe has very similar ideological, political issues the United States has, right? Yes. You have this anti-government, anti-science kind of movement,
right,
that exists and makes it impossible, because you need a large enough percentage. Just like with herd immunity, if 95% of Americans were making sure this thing wasn't spread around, we would be in much better shape. Because the 5%, they can do whatever they want, but the 95% is going to make sure this thing doesn't spread.
Right.
But we have more of a 50-50, which, as you know, the 50-50 with a virus or a political ideology, you're not going to win that battle.
Well, especially with a virus, because essentially, the virus is not that you actually can talk to and say, hey,
it's a reality.
Be reasonable here, right? That is not how a virus works. So
this is sort of a sign of like Western individualism showing its weaknesses. It's obviously there are great strengths to individualism, but the weakness is that if we can't corral together as a team and work as one, then we fail against an enemy, a common enemy.
Right, and this is where, like, even all of us, westernized Europe, America, if we look at World War II, we look at Hitler, we look at Nazism, right? The world banded together to destroy this. And guess what? Did it successfully. There was a ton of sacrifice. People, but all these countries went after it. And guess what happened? Right? Hitler's gone. And something like this, you have to have 95%, going after it. Like the vaccine levels for measles is 95%, right? So you have to have enough people going after it so that it's not a problem. But the 50-50 doesn't matter what California does. Like California is going to keep its levels where it is. New York should keep its levels where it is. Florida will do something in between, right? Georgia, who knows? Because that governor's crazy. South Dakota, who knows? But we have this very fragmented control systems that it makes it impossible to control the virus beyond just educating individual people and their families and their grandmothers and their people with pre-existing conditions. Like we need to change the message from the government to somehow personal responsibility, right? Because there are 250,000 people that have passed, and let's say they know 10 people. So there's 2.5 million people in the United States that probably wish it went a different way. Unfortunately, that's still only 1 or 2% of our country. Does that need to grow to? Does that need to double that? Does there need to be 5 million people that have this experience? Does there need to be, 10 million, 20 million? Like at what point does it matter?
It doesn't. That's my opinion, Matt. It really doesn't, because it's taken 45 years to eradicate polio. And that was only because of a very effective virus, very effective tracing and diagnosis, and a very concerted international effort, right?
Well, you have Bill Gates putting billions into this. Would it have happened without that funding? Probably not.
That was the World Health Organization, WHO. They actually kind of spearheaded that effort, and we only just beat it. So, viruses don't go away. The flu has been with us since ever,
Forever, right?
Yeah. So, and it keeps coming. We can control it to a certain extent, but we can control it because it's a not that virulent as an infection. Something that is as virulent, as easily spread as this, with a mortality rate of 1%, in the best case scenario, right, cannot be stopped unless everybody comes to the same agreement, and nobody, there's no, what we're doing is that in this kind of short-term view, that we look at ahead of 2 or 3 months and say, California is doing well and Texas is doing badly. That doesn't make any sense, because there's going to be your friend that is going to go on a trip to Texas because his family is there and going to bring it back to California. So in 3 months, we're going to see another spike in California. In San Diego, we've been going through yellow, orange, red, orange, yellow, orange, yellow, red, orange, yellow. Cases spike and then go down because people, liberal, conservatives, don't change their lifestyle. And this was another point that I tried to make several times with Andrew, that we had another pandemics in the 80s. There was the HIV/AIDS pandemic.
Yep.
The only way we actually resolve the pandemic is not through treatment. Treatment alone hasn't done anything. It's kind of, it's reduced mortality, it's reduced, people getting sick a little bit. But what has changed a lot is changing lifestyles. Lifestyle changing.
The education of people.
Education.
Yeah.
Understanding how the virus spreads, understanding what you do to actually stop, getting it. The same with hepatitis C. There is another pandemic in this country that is under-recognized, and it's the hepatitis C pandemic. Hepatitis C, you don't realize you have it maybe for 20 or 30 years. And a lot of the people that have hepatitis C will never have symptoms. But there is a very small group of people with hepatitis C will progress to have liver failure and cirrhosis, or cancer, or liver cancer. So what do? We educate, right? Don't share toothbrushes. Don't, with somebody that has hepatitis C. Don't have unprotected sex. So we do all these kind of things for everything else. And now we have this new threat, and we're treating it as something that never happened before in history, that we actually can debate on how to address, because it's a matter of opinion rather than of experience. And we just think ahead in the next 3 months. So now, before we were looking at the summer, in March, we're looking forward to summer and say, oh, we're going to reopen in the summer. Now we're looking forward to when they launch the virus, the vaccines, so that we can go back to normal. Shouldn't instead we change the way we do things so that this is going to be a threat that is going to be contained for the time and for the future, regardless of vaccines and therapies and anything else?
Totally.
Yeah. That's and that was, if we had taken that approach in January, February, March, here's, and the numbers, I'll just round up. 20% of Americans should not get this virus. Right? Not to say that it can't be affected, but it's going to be most dangerous to these 20% of people.
Mm-hmm.
And we need to keep, and I did a post on March 13th about Kira's grandmother. I'm like, all this stuff's going on. We don't know, but we know Kira's grandmother, 95 years old, smoked her whole life, has some underlying conditions. She should not get this thing.
Right.
No doubt in my mind, she should not get this thing.
Right.
And then we do more of the education of like, who in your circle, right, is in this situation, and what can you do to protect them? Because it's not about necessarily protecting, the younger, stronger, right, with no conditions, right? But there can be issues there as well, but not
in the high, not in the high probabilities.
So to me, that's also a skewed argument. Sorry, because again, let's think about this, right? Statins are given to people with a risk of heart attack. The risk of heart attack for somebody without statins, with risk factors but without statins, is about 30%, right? And the probability that you will die from a heart attack is approximately 5 to 10%. So we're actually giving statins to millions and millions of people to prevent a 30% risk of contracting an illness, which has a 5 to 10% mortality rate. Right? So, but we do take, precautionary figures. When I hear these arguments, you shouldn't do it because it's your grandma, or because, it's your relative with autoimmune conditions or immunocompromised. What is the acceptable, and having arguments around whether that is right or not, and whether there is a acceptable collateral damage that you need to take on board, because that's how life goes. We don't do that in any other field of healthcare. Doctors used to have to take the Hippocratic oath that says, I will not do R, which
Right.
means that you don't take a risk in the first place. There is no acceptable risk to human life. So,
No, and
that's why you do everything you can to save somebody when they come to ER, just because you say, well, I only have a 10% chance of saving this person, and I'm going to spend, 3 hours and $50,000 on treatments. Therefore, I'm not going to do it. Right? You still do it.
Yeah, no, and I think we, obviously you're passionate about this, and maybe I misstated it because my view is.
I'm Italian, I'm always passionate, Matt.
Right. Well, and I love that. And, I'm English, but I'm so handsy like an Italian. But it's because what we're having trouble with is getting people to realize that this is important for them to do, right? Like a 25-year-old, how do you give them the message of they're looking around, especially if you're in a place that hasn't had a problem, right? Like New York, the people in New York have been through the hospital ships and the convention center being converted and a hospital being built in Central Park. So they've actually had very visual things. The people of El Paso are seeing all of these freezer trucks being rolled up at the morgue, the coroner's office, right? And they're adding more of these freezer trucks for dead bodies. So they're getting this visual. So one of the things, especially as time goes through, is how do you message this to get people to still believe? Because you obviously understand this, right? As I do, as Andrew does. But how do you message this to people that don't, and they don't see it, right? Like if you lived where I lived, right, and I have a hospital right across the street. In the early days, every day I'd walk out there, right, to see if they were getting like a buildup of things. But we've never, in this part of LA, we never had it get crazy viral on us. And probably because people are keeping their distance and doing the right thing, right? So there's so many people doing the right thing. So you want to keep them doing that for the people that are, right? It's like, this is important. Let's keep it up, because, it shouldn't have to come down to, freezer trucks rolling up at the corner in El Paso, or, digging the graves in a little island in New York, right? It shouldn't
have
come down to these visual moments.
But unfortunately, Matt, it does. I mean, this is what we know about human psychology, is that it's, if I don't see it, it doesn't exist. This is our automatic routine mental functioning. It's sort of the basis of many cognitive biases. And so until we get a visual picture or some sort of actual emotional impact of the reality, it's not real to us.
Right. So the reality is also this. I don't know, Fabio, if you saw the coronavirus task force briefing. I think it was on Thursday. I don't know if you take time to watch them anymore, but I did. They do them once a quarter when they were like, oh, the American people, this is a problem, so we got to say something. So so it's like, oh, we have this vaccine and Project Warp Speed made it and blah blah blah. I'm just trying to take credit for other people's work, typical. But what they did not say, right? And I always look for what people don't say, is they didn't say we have the test, the positivity rate is one of the highest it's been, the hospitalizations are the highest it's been. They did not say, please, Americans, we have these vaccines and these therapies and all of these things that can definitely help it. But the most important thing isn't those. It's what you could do today to not spread this thing. Right. And they did not say that, which is very telling to the political side of it, because the mask is a political issue. And guess what? They didn't have the cojones to say you have to wear a mask. Yet the governor of Utah now does. The governor of Ohio, North Dakota, Indiana, all these governors are now experiencing what Cuomo did, even DeSantis, even, Texas, they're experiencing this in real life. And they're like, oh, wait, hold on.
Right.
We need to change our message here.
So it's difficult to understand for most of us. And the issues are, one, we're not built to understand statistics and probabilities very well. That's a trained skill. It's ironic to me that all genetics work in exponential growth, and yet we don't understand it. It's like that's how you grew from a baby. That's how you grew from a single cell in the womb into a whole human being, is through exponential growth. But it's hard to somehow get our minds around that concept. And then the other thing we really need to understand, aside from just how something this viral spreads and how it just hits all these people and just keeps splintering out before anyone knows, is that the weakest link resets the safety for everyone in your group. And that's something I think that younger people still are not quite grasping. Is like this: when you have one person in the group who doesn't maintain those standards, everyone in that group is now at a much higher risk level.
I think we're talking objectively, right? We're talking about objectively, this is what happens. But I can tell you that even people that had, that saw the trucks, the refrigerator trucks go in, even people that saw the hospitals built out of the tent, even people that even people in the health system that have been treating patients with COVID, they, when I went to hospital the last time, the nurse came into the room. My roommate was on Fox News for the entire time I was there, and this nurse comes in and she starts talking about Donald Trump, and that the virus is an hoax and that it's a democratic thing, and she's a fucking nurse working in the hospital seeing patients coming in. So we are actually in a scenario where it's not even personal experience doesn't change your own perception of reality. I think that we have really a moral and cognitive dissonance which is going on that doesn't allow us to process the reality, because this is so out of what we ever expected would happen to us.
Well, because we have to always acknowledge that no one alive today has experienced, there's probably a handful, sorry, the Spanish flu was 100 years ago, but no one really has gone through something like this. And the idea with the affluence of society since World War II, like we can do whatever we want sort of mentality, is we as a society and a civilization have not looked at our history and understood that Mother Nature is probably the strongest force on this planet beyond us. And we've had our plagues, we've had disease happen over the course of our history. Mm-hmm. Whether it's a culling of the herd or whatever it is, survival of the fittest, the Darwinism thing, it's a part of our reality that, that we only see in third world countries mostly, with polio and some of these diseases that are still ravaging, civilizations that we're past. They're not past. We want to have this perfect, germ-free world.
Ever, right? Until we don't, we have urbanization, we still haven't have infections. But you see, the problem, Matt, is that how do we come together on polio? How do we come together on other infectious diseases? How we come together to fight, common threats? So, in your example, we came together, the Western world, and I can't say we because I'm Italian, so I'm actually on the side of the loser when it comes to
Well, but we're not judging you. We're not judging you.
World War II. But now as a citizen of the US, I kind of feel entitled to say we. But America, Britain, the UK, and Russia came together, right? And Russia was even then an existential threat to the US.
But we had a common enemy.
But they had a common enemy, and they came together. With this thing, we are not finding that this is a common enemy. We are not finding that there is a level of cooperation that is required to help each other.
Because we're seeing nationalism all over. Because Russia said, we have a vaccine. Everyone's like, we're not interested. China says, we have a vaccine. Everyone's like, we're not interested.
We're not interested because,
But let's look at the science. Like, maybe it is a good vaccine. Instead of saying we're not interested because of nationalistic political purposes, but let's look at the science.
Yeah, we don't have access to that information. That is the problem, is that like the Pfizer vaccine, we only have press releases to tell us what the vaccine from Russia or from China do. We don't have, peer-reviewed data that gives us both, the advantages and potential dangers of those vaccines. So for instance, with the Pfizer vaccine, we know that there is a 20-30% rate of adverse events of people feeling sick after being administered the vaccine. So, it's not like drinking rose water and eating chocolate muffins, right? It's not it's not that simple. But what I find quite extraordinary, that I never thought I would see in my lifetime, is to see people, and again, this is even from a personal perspective, right? So people that know me and that have been kind of with me through the, when I was really sick and kind of, coming to help me out and kind of bring me food, for instance, who now are completely dismissive of the virus. People that had the infection that now are really relaxed about doing a number of things, going out, bringing their families out, going to communal places and all that kind of stuff. So there is a level of saying, even if it's very close to me, as long as it doesn't affect me personally, I'm not going to change. And even when people are affected personally, they're still not going to change, because there was like all over the newspaper, there was the case of that guy, that MAGA supporter that was like a vaccine denier. He got into hospital and died. And while he was in hospital, he recorded this blog saying, I love you, everybody, and I still think that, I did the right thing, and, MAGA, 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 all the way around, and he died. So there is even that level of consciousness is missing. And I personally think that we lack, as a society, a moral compass, because that is what guides us, right? That's what I was talking about when I said, as a physician, you take an oath that you're not going to cause harm. That's a moral code, right? It's ethical and moral code. In this society, we say, what I need is more important than the needs of the many. Right. So that's why you have all this kind of disconnection, and again, going into the politics of people kind of championing anti-racism, but not wanting to spend another 3% in their tax on socialized healthcare or free education. But they're ready to champion, destroying all the Confederate monuments, and and they will sign for all of those progressive clauses. So everything is very cosmetic when it comes to actually putting your money when when your mouth is. Nobody wants to do it because it's too much of a sacrifice. Changing lifestyle, changing the way you do things is too much of a sacrifice for this society, which is similar to what happened with HIV when a small community of people started having HIV parties where they were getting infected instead intentionally so that they didn't have to go through the problem. Hi.
Fabio, this is my wife, Kira.
Hi, Kira.
She's like, what are you guys talking about? I want to be a part of it. I'm like, it should be live on Facebook.
Can't find it.
So,
oh, boomer.
So
you know what I mean? It's kind of, it seems to me that we are not prepared to actually do anything for the common good, which is not an immediate reward.
Yeah.
But, well, it's the when you look at, in American history, you look at the Great Depression, right, which is 90 years ago, right? So much was lost that people kind of had to come together, right?
Right.
And like, how do we get through this thing? How do we just scratch a lifestyle out, right? And World War II, especially the Pearl Harbor, like we were helping our allies, but we're like, we don't want, it's not our fight.
Right.
But then Pearl Harbor happened. It's like, oh, this is our fight, right? And also, kind of was the catalyst. Not everyone was on a board, by the way. They're like, let's just have our own little life over here. We don't care about them. Mm-hmm. But enough people were broad-minded enough to realize it will never work that way. If Hitler takes Europe and with Japan, they take over the rest of the world, we can't defend this little plot of the world by ourselves.
It's that will high castle, right?
Yeah, that will never work. So there was enough people that saw a success of Hitler and Japan as being an existential threat to our country, right. And that we must, even though it's hard and we're going to lose, sons and that we must. And this we're at this. Well, who's losing exactly what today, mm-hmm. Right? And there are certain people that have gone through this experience. That's why we talk about it. And unfortunately, America, where we stand today, especially with the information war, right? Half the country thinks it's a hoax from the Democrats to control you. The other half of the country is like, well, this is a serious virus that we should be managing. And the reality is there'll be states like California that'll go on its path, Oregon, Washington, New York, the North, the Northeast, and kind of everyone else is going to have to go down their own path until you get to that motherfucking moment where it's like, oh no, we got this wrong, right? And that's the reality. Like, I don't want to say that this is how it should be, but it's like you said, is people are just, there's not enough compelling things affecting their lives directly,
right?
That and it draws on for so long, right? Because 6 weeks you can pull off, but not 9 months.
Right, and that's why a lot of people have this thing that is called COVID fatigue, right? Yeah. And even myself, I'm like, oh, I'm gonna go out for lunch. I don't care. This,
well, you have your I've had COVID sticker, which
Yeah, but again, today Boris Johnson went back into isolation because he came in contact with COVID, with somebody who got infected. Because again, in the UK, they actually do very good contact tracing, and he already had it. He was in ICU for 3 days, right? So it really doesn't matter. You should be conscious anyway. And the fact that I've had it doesn't mean that I kind of get my sticker off and kind of do everything that I want.
I wish this is how our country works, and I realize it absolutely does not, and it's it's gonna just play itself out, and it needs to do it at the state, regional level, unfortunately, and unless the governors have the vision to like not have to play it out, right?
I think
But there's a lot of governors that don't have that vision.
yeah, I have a different vision altogether, frankly. I think that this is gonna go, or this is gonna get resolved. Because again, even Taiwan, even Australia, even New Zealand, they don't have the perfect, this is not the perfect solution.
Right, they're defending their borders.
Right, but
can you
there's
do that forever? Can you do that forever?
much that you can keep that up, right? And again, already in Australia, we've seen a creeping up of cases, even if it's the summer season. But to me, like with every other pandemic or epidemic that humanity has gone through, things are going to change once we accept that we need to make permanent changes to the way we live in our society. And we stop talking about going back to normal, because normal is never going to be as normal as it was, 10 months ago. Yeah. And until we come to that realization, I think that no strategy is going to work.
Yeah, but normal could be normal, but we now are educated as a people in a society. So if a new virus comes along, everyone knows how to deal with it, right? So you can do normal, right? And I don't think that should be thrown out, because we have to see how long this sticks around. We have to see the effectiveness of vaccinations. There's so much to see to say that we won't have a quote unquote normal. But what I hope we would have is that the reality, which like Asian countries have this reality, is viruses happen, right? This is Mother Nature. Right. And just because they don't always get out like this one doesn't mean they don't exist. And you have to educate your people, have the medical equipment, etc. So then when it does present itself, you have the protocols, procedures, contact tracing, equipment, so you can manage it, in a manageable way, because they are all manageable.
But you also have, again, if you haven't gone to Japan, I've been to Japan a bunch of times, and the people can wear masks all the time. We used to laugh for people in Japan wearing masks. Now we understand. So normal is going to be wearing masks in public, right?
And that's okay. Let's depoliticize this thing.
Right.
And
normal could be let's not travel as much as we are used to, and only travel. For instance, the majority of the travel for business for airlines is not tourist travel. It's business travel. It's people that go from one place to the next for a 1 hour or 2 hours meeting that could have on the phone. And let's not do that anymore. What is the point of doing something like that when it costs a lot of money, time, and stress? And people get sick more, right, independently, just because they are on planes all the time. So, that's a change, but that requires a change in the industry, right? Accepting that some industries become outdated or out of, no longer primary as we used to think about it. So that is the shift that I'm thinking about, so that we actually start considering things that were important, less important, that we take advantage of technologies to change the way we operate, to be mindful and considerate when you do things, and to be accepting that, like we do with driver's licenses, with passports, that you have to accept a level of limitation to your personal freedom in order to function in a society.
I agree.
So maybe we need to have immunity passports, or you know, or you need to plan a trip, you need to have 2 days between getting a test and going on your trip, right? So to minimize the chance of spread. So we have to start doing things differently.
Well, I
I
think
agree.
that's a good place
And we
to wrap up. Do you have one last thought, Matt?
No, I was just saying, do we want to get into the status of the election, or
guess
are we
not.
are we out of time there?
I guess not tonight. I gotta wrap it up for tonight.
Oh,
so.
wow, yeah.
Well, the simple answer there is Trump administration is never going to accept a recount, an audit, whatever. That's just going to happen. Georgia recount is November 20th, and they had the Dominion voting system. So that in itself, and they have their own auditing, processes. So that in itself should kind of give us all we need to know from all of this about Dominion voting systems, about all the allegations of this and that, and if mail-in votes or whatever. So November 20th is something to just look forward to. There's no active court cases that are going to change this currently. They're just playing information war in conservative media, and they think they have 71 million people that voted for Trump, and they don't realize that 30 to 40% of people just vote the color of their political party. So Trump doesn't actually have the number of supporters he thinks he has. And I think Washington, D.C. on Saturday, it was probably 150,000 people. If that was 10 million people that showed up, that would have been very telling, right? Like just a sea of humanity. It wasn't. It was probably 100,000 people. So
I gotta go, guys. It's been a great conversation. Thanks a lot. We'll talk politics next time.
sounds
All right.
good.
Thank you.
All right, guys.